today's session. Myself Rajita, and in this session, again we are going to discuss regarding the few electrolyte imbalance what we were discussing in the previous session. In this session, basically we will be focusing on the magnesium imbalance and phosphate imbalance, their causes, the clinical manifestations, as well as the basic management or treatment for preventing any complication or further disease progression. So let's get started with the discussion of magnesium imbalance in an individual's body. So magnesium is the second most abundant intracellular cations. As we know, it is basically predominantly present in the intracellular spaces. So magnesium plays a very important role or essential role to continue the cellular processes and the metabolism of it. So basically, the action of the magnesium includes the magnesium is considered to be a coenzyme for protein and carbohydrate metabolism. We are going to see in the protein and carbohydrate metabolism, which is going on in the cellular way, the magnesium will be working as a coenzyme. The next function, which is very essential function of magnesium, is to maintain the balance of calcium and potassium in individual's body. Next, we are going to see the magnesium also plays a very important role to maintain the function of sodium and potassium pump in our individual's body. So in another term, we can say the sodium potassium channel will be basically regulated by the presence of magnesium. So it is a very major and important role of magnesium in a human body. The next is also the magnesium will be maintaining the neuromuscular activity and contractility. So we are going to see these are the all major functions which will be done by magnesium in a human body in a physiological state. So as we have learned the physiological process for the activity of the magnesium in an individual's body, now we should learn what if there is imbalance of the magnesium within our individual. Basically, here also we are going to see two types of imbalance of magnesium. One, where we are going to see there will be increased amount of magnesium compared to the normal level in individual's body, which will be termed as hypermagnesemia. So hypermagnesemia we will be considering if the level of magnesium is increased more than 2.5 milliequivalent per liter. So here first we are going to discuss regarding the condition of hypermagnesemia, the causes and the clinical manifestations, even the basic treatment of this condition. Etiological factor, the basic and common etiological factors which will be often associated with the development of this condition of hypermagnesemia includes renal failure. So renal failure almost always will be causing an increased amount of build up magnesium in the blood circulation, which will be ultimately causing development of this condition. In the next etiological factor, we are going to see most commonly adrenaline insufficiency. The condition of adrenaline insufficiency will be playing a major role in the development of the hypermagnesemia. Excessive administration of magnesium also plays a very important role in the development of this condition. That is the reason careful administration of this particular electrolyte plays a very important role in the prevention of the development of hypermagnesemia. The next condition is tumor lysis syndrome, which will be almost always causing a severely increased magnesium in the body, and the person will be developed with the clinical manifestations associated with this condition. The next condition is diabetic ketoacidosis. Often diabetic ketoacidosis will be increasing the magnesium amount in the blood circulation which will be exceeding the normal level into the blood circulation. That is the reason often the client with diabetic ketoacidosis will be present with the clinical manifestations associated with hypermagnesemia. So we are going to see the major and most common clinical manifestations which will be often seen among the client. It includes lethargy and weakness associated with hypermagnesemia. Next condition is flushed and warm skin. Now, it is a very common feature among the client who is suffering from hypermagnesemia. Basically, we are going to see they will be having a flushed and warm skin on touch. Decreased pulse as well as decreased blood pressure is a very significant feature or clinical manifestations associated with this condition. Often, the client with hypermagnesemia will be present with a chronic nausea and vomiting. That is the reason associated with this condition. Even a person will be having a high chance or high risk for the development of other electrolyte imbalance, mainly the deficiency of other electrolyte imbalance in the body. Muscle weakness is also a very common manifestations associated with this condition. Often the client will be complaining about dysphagia associated with hypermagnesemia. So basically dysphagia suggests here difficulty in swallowing. So a client will be complaining about difficulty in swallowing associated with this condition at a very early stage. So I hope till here we have learned regarding the common and probable etiological factors, as well as we have seen the most commonly associated clinical manifestations of hypermagnesemia. Now we are going to learn about the basic management and treatment to prevent or to manage the condition of hypermagnesemia. So while discussing the management, it is to be noted that prevention here plays a very important role. So as we have seen, a person with chronic kidney disease, diabetic ketoacidosis, this disease conditions will be increasing the risk for the development of the condition of hypermagnesemia for a client. That is the reason prevention plays here a very important role in the preventing of the development of any condition associated with it. So basically, we are going to suggest the client with a history of chronic kidney disease or diabetic ketoacidosis to reduce magnesium containing food intake. So often we are going to see whether any prescription has been given, which is basically the medication is containing magnesium. So it is to be noted the drugs, even the dietary intake should be lowered in containing of magnesium. We will be often teaching the client and their caregiver to avoid food like green vegetables, nuts, bananas, peanut butter, even chocolates. Basically, these are the food products which will be having very high amount of magnesium. Even certain medications or over-the-counter medications which contain a huge amount of magnesium that will be restricted for our client with high risk. So as a medical professionals, it is a very important role of us to identify the high risk population in a clinical setup or in a community setup to prevent the development of hypermagnesemia. Now, hypermagnesemia even will be treated if there is development of acute clinical manifestations. Naturally, intravenous administration of calcium gluconate or calcium chloride plays a very important role in the reducing the signs and symptoms related to hypermagnesemia. Basically, this two agent will be administered intravenously to a client in order to reduce the effect of hypermagnesemia in the cardiac muscles activity or the contraction and relaxation. That is how we are going to prevent the sign and symptoms development of the hypermagnesemia for a client. Associated with that, A client who is already present with excessive amount of magnesium, promotion should be done for urinary excretion with oral and parenteral fluid. Now, urinary excretion of magnesium definitely will be reducing the amount of magnesium directly into a person's body. Intravenous furosemide always will be administered to decrease the magnesium level. Now, furosemide plays here a very important role to excrete the magnesium through by increasing the urinary output and magnesium content in the urine. That is the reason often we are going to see if a client have developed with manifestations associated with hypermagnesemia, the furosemide often will be prescribed to manage the client. Now, if there is a complete functional disability of the kidney or kidney failure is present, maybe a person will be suggested to go for dialysis. Even this procedure of dialysis will be helping to maintain normal level of magnesium in an individual's body. So I hope till here you got the basic concept of hypermagnesemia, when we are going to call it as this condition, what are the probable causes, the clinical manifestations, as well as the basic treatment modalities which will be used to manage the client with this condition. Next, we are going to learn about the second type of magnesium imbalance, that is basically termed as hypomagnesemia. So as the term itself is suggesting, it is occur when the magnesium level in the body is decreasing compared to the normal level. So when the magnesium is present less than 1.5 milli equivalent per liter in the body, we are going to term this condition as hypomagnesemia. So let us discuss now regarding the probable causes, the clinical manifestations, as well as the treatment or the basic of the management of hypomagnesemia. The major common causes or etiological factors associated with the development of hypomagnesemia include severe diarrhea and vomiting. So often a client with a history of a severe and excessive diarrhea and vomiting will be present or it can be present with hypomagnesemia, because you need to understand these are the condition where a person will be directly losing the magnesium through the diarrhea and vomiting. There's a reason why a client will be often present with this condition associated with excessive and severe diarrhea and vomiting. The next condition is chronic alcoholism. So if a client is having a history of a chronic alcoholism or a history of consumption of alcohol for a prolonged time, this also can increase the chances of the development of hypomagnesemia. The next common condition is malabsorption syndrome. So client with a history of malabsorption syndrome, for them we are going to see the magnesium absorption from the intestinal wall or from the gastrointestinal tract will be disturbed. There's a reason within circulation, the level of the magnesium will be depleted, and the magnesium definitely will not be able to function their activities. There's a reason why a client will be often present with the clinical manifestations associated with this condition. Prolonged malnutrition often will be associated with the development of hypomagnesemia. So basically in prolonged malnutrition, we are going to see a client will be having lack of dietary intake. Now, as the dietary products will be avoided, which are rich in magnesium, definitely will be causing a direct effect or direct development of hypomagnesemia. Next condition is a prolonged or increased urinary output. Now, certain conditions or the usage of certain therapies like diuretics, if it is going beyond the level and if it is increasing excessive amount of urinary output and urinary excretion from the body, this will be often associated with the development of hypomagnesemia. Poorly controlled diabetes mellitus Even hyperaldosteronism often will be associated with the development of decreased level of magnesium in the body. The next condition, which is basically a therapeutic effect, which will be often present in a patient who are admitted in clinical setup, is the effect of nasogastric tube suctioning. Now, for a client with whom we are performing the nasogastric tube suctioning, they will be having a very high risk for the development of hypomagnesemia. Now, as we have learned, the basic causes or etiological factor associated with the development of hypomagnesemia, next we are going to learn about the clinical manifestations. So, the clinical manifestations include the confusion of a client, often with a hypomagnesium state. We're going to see our client will be present with acute confusion. There can be presence of tremors even in the extremities, as the neuromuscular activity here is getting impaired or altered. Even client with hypomagnesemia can be present with a frequent seizure episodes. Here we're going to see a client will be having a very frequent seizure episodes that is basically due to the neuronal impairment caused by the decreased level of magnesium in the body. The next manifestations, which is very commonly seen among the client, is hyperactive deep tendon reflexes. Now, these are the very significant manifestations of our client who is suffering from hypomagnesemia. So, as we have learned regarding the hypomagnesemia, now you need to note it down. The basic treatment will be treating the underlying disease condition which is causing the development of hypomagnesemia. The other basic treatment modalities includes the parenteral or oral administration of magnesium to the client to manage hypomagnesemia. So I hope till here you have completely got the idea regarding the magnesium imbalance. We have discussed hypermagnesemia, even hypomagnesemia, the etiological factor, the clinical manifestations, and the basic treatment to manage those conditions. Now we should move on to the next type of electrolyte imbalance, that is basically the phosphate imbalance. So phosphorus is the primary anion which is present predominantly into the intracellular compartment. We're going to see most phosphorus will be present in bones and teeth associated with the calcium. So essential, phosphorus plays a very essential role even to continue the functional ability of the muscles in the body. Now there are few major functions of the phosphorus which will be played by it inside an individual's body. We will be learning the functions one by one here. So the formation of the red blood cells, even the activity of the nervous system will be majority controlled by the presence of phosphorus. Often we are going to see the acid-base buffering system will be depend on the amount of phosphorus that is present inside a body. So in the next session, when we are going to discuss regarding the acid-base imbalance for a particular individual, we are going to see that the phosphorus here play a very important role to maintain the balance of acid base for an individual's body. The next important function of the phosphorus is mitochondrial formation of adenosine triphosphate. So as we know, mitochondria is basically the energy house or energy production house inside the cell. So it definitely helps to generate the adenosine triphosphate, which will be the basic fuel for the energy production for the cellular metabolism to continue. This phosphorus plays a very important role in the formation of adenosine triphosphate in the mitochondria. The next function includes it also have a very important role to maintain the metabolism of carbohydrate, protein, even fats. So that is how phosphorus plays a very important role in the maintenance of the bodily function at a physiological state. Now, imbalance of the phosphorus definitely will be causing the development of certain signs and symptoms in a patient. So let us discuss regarding the probable causes, the etiological factors basically, and the clinical manifestations and the basic treatment modalities to manage the phosphorus or phosphate imbalance. So first here we're going to learn about the phosphate imbalance where the amount of phosphate is getting increased into the blood circulation. Hyperphosphatemia, which is more than if it is present more than 4.4 milligram per deciliter, we are going to call this particular condition as hyperphosphatemia. As the term itself is suggesting, it is indicating increase in the level of phosphate compared to the normal level. We are going to learn here first regarding the probable etiological factors or the common causes which will be often associated with the development of hyperphosphatemia. So causes includes first the renal failure. Renal failure often causes the kidney not to able to function in a proper way. So here we are going to see development or buildup of the phosphate can occur in an individual's body, which will be ultimately causing the development of hyperphosphatemia. In the next condition, which is very common causes for the development of this condition, is the usage of chemotherapeutic drug. So for a person who is on a prolonged treatment of chemotherapeutic drug or who is receiving a chemotherapeutic drug, it is considered that they will be having a high risk of the development of increased amount of phosphate in their body. The next condition is enema, which will be containing phosphorus. So in a therapeutic procedure, if we are performing or if we are administering enema for our client, now if the enema is containing phosphorus in maximum amount, we're going to see our client will be having a high risk for increased phosphate level in their body. The next condition is excessive ingestion of phosphate containing food. Now, definitely, if we are excessively intaking a food which is high in phosphate content, so we are going to see that the absorption of the phosphate here will be increased, and definitely our client will be present with the clinical manifestations associated with hyperphosphatemia. The next condition is definitely a sickle cell anemia. So often a client who is having a history of sickle cell anemia, they're having a high risk for the development of increased phosphate level in their body. Now, we're going to learn about the basic clinical manifestations which will be often present associated with hyperphosphatemia. So the first clinical manifestations will be indicating the development of hypocalcemia in an individual's body. So when we have discussed regarding the calcium imbalance, we have seen all the features associated with hypocalcemia. A person with hyperphosphatemia often will be present with the feature of hypocalcemia. Even they will be having depleted amount of calcium in their body. The next manifestations, which is very commonly complained by every patient who are suffering from hyperphosphatemia, is the numbness of the extremities. The next condition includes hyperreflexia of the muscles. Even the muscle cramps also here plays a very important role to identify that the client is suffering from hyperphosphatemia. The next condition is the development of signs and symptoms associated with tetany. So often the person with hyperphosphatemia will be showing the feature of tetany, and abnormal muscle cramp will be present into the extremities and into the facial muscles. Even a client will be often developed with episodes of seizure if there is presence of hyperphosphatemia. Deposition of the calcium phosphate. is very commonly seen mainly in the skin, soft tissues, in the corneas, in the viscera or visceral area of the blood vessels. We are going to see the development of calcium phosphate in the individual who are having excessive amount of phosphate level in the body. Now, as we have learned the etiological factors and clinical manifestations associated with hyperphosphatemia, next we are going to learn about the basic treatment and management modalities which will be used to prevent the disease progression and the development of complication. So the primary management includes the symptoms often will be including related to the low serum calcium level and high serum phosphate level. So you need to make it clear whenever we are going to treat a client with hyperphosphatemia, we need to look for the symptoms management both which is present for low level of serum calcium and a high level of serum phosphate. Now, the basic goal of the management always will be including identifying and managing and treating the underlying disease process, which plays a very important role here to prevention of the manifestations development further associated with this condition. The next is restricting ingestion of food and fluids which contains high amount of phosphorus. So basically a patient and their caregiver would be educated by a nurse or a medical professionals regarding the food product which contains high amount of phosphorus. Avoiding of those food products, even certain medications or over-the-counter medical agents often will be helping the client to prevent the disease progression and development of complication. Enhancing the elimination of the phosphorus plays here a very important role. Often a client with high risk of hyperphosphatemia will or should be avoided with the administration of phosphorus containing enema. Now, often the excretion of the phosphate will be increased by using the procedure like dialysis if it is indicated for a particular client. Minimizing the phosphate absorption also plays here a very important role to manage the client with hyperphosphatemia. So, reducing the intestinal absorption by using phosphate binders plays here a very important role to reduction or to prevention of the hyperphosphatemia progression. So as we have learned here regarding the development of hyperphosphatemia and the basic management, now we should learn about the second type of imbalance of phosphate which is often can be present for a client is hypophosphatemia. As the term itself is suggesting, it is suggesting when the client is present with a lower level of phosphate in the body compared to the normal one. So basically here the phosphate will be present less than 2.4 milligram of phosphate per deciliter. So then we are terming the condition as hypophosphatemia. So now we are going to discuss regarding the causes, the clinical manifestations and the basic treatment modalities to manage the hypophosphatemia. The causes includes first is malabsorption syndrome. Often the malabsorption syndrome will be causing decreased amount of absorption of the phosphate into the circulation from the gastrointestinal tract, which will be ultimately causing the development of hypophosphatemia. The next condition which is very often associated with the development of hypophosphatemia is malnutrition. So malnutrition often will be developing the condition of hypophosphatemia where the client will be present with decreased amount of phosphate in their body. The next condition is glucose or insulin therapy. So insulin therapy also plays an important role which will be increasing the risk of the development of hypophosphatemia for a client. For a client who is on a total parenteral nutrition for a prolonged time, they also will be having increased risk for the development of hypophosphatemia. Alcohol withdrawal, or the phase where the client is suffering from alcohol withdrawal syndrome, often will be developed with the clinical manifestations associated with hypophosphatemia. Phosphate binding antacids. These are the major causes or agents which will be often increasing the chances of the development of hypophosphatemia, because these are reducing the phosphorus or phosphate absorption through the gastrointestinal tract. So a client who is on a medication with phosphate binding antacids often will be increasing the chances of the development of this condition. Recovery from diabetic ketoacidosis often can develop the condition of hypophosphatemia for a client. Respiratory alkalosis also will be directly causing decreased amount of phosphate in the body and development of associated signs and symptoms. The clinical manifestations related to hypophosphatemia often include central nervous system depression. We will be seeing there will be alteration in the central nervous system and its activity. Even our client will be complaining about a severe muscle weakness in case of hypophosphatemia. Polyneuropathies are also very common manifestations associated with this condition. Development of seizure episodes frequently is seen for a client with hypophosphatemia. Cardiac problem like dysrhythmias, stroke volume, which will be often decreased from the heart, will be manifested as in case of hypophosphatemia. So definitely a client will be having high risk for decreased tissue perfusion due to lack of stroke volume. The next manifestations, which is very often or commonly associated with hypophosphatemia, is osteomalacia and related symptoms. Rhabdomyolysis is often commonly seen associated with hypophosphatemia for a client. So I hope you are completely clear now regarding the basic causes and the manifestations of hypophosphatemia. Now we should discuss the basic of the treatment or management modalities to manage the client with this condition. Oral phosphate supplementation and vitamin D supplementation plays here a very important role. Symptomatic hypophosphatemia often requires intravenous administration of sodium phosphate and potassium phosphate. Now, often a client with the observable symptoms, we will be managing them in a clinical setup with the intravenous administration of sodium and potassium phosphate. This plays a very important role in managing the symptoms primarily, as well as to correcting the phosphate balance in the body. The next activity or the next step of the management include the serum phosphate and calcium level monitoring. Now this plays a very important role to identify at any early stages which will be indicating any changes associated with phosphate balance. Initiating at early treatment at an early stage plays very important role to prevent the disease condition progression, as well as to prevent any sign and symptoms development associated with hypophosphatemia. So I hope till here you completely got the idea. So in this session we have discussed regarding the magnesium and phosphate imbalance mainly. So throughout this whole sessions we have seen different fluid and electrolyte imbalance and their effect and their basic management. So in the next session, we are going to just out the overall management, because you need to understand fluid and electrolyte balance or imbalance will be almost always will be occurring for a particular person in the same time. Even as we have mentioned before, our client often will be presented with various electrolyte imbalance into their body. That is the reason in the next session, we are going to just out the overall management and assessment which will be done for a client who are present with the signs and symptoms associated with electrolyte and fluid imbalance. So thank you so much for attending this session. We'll meet you guys in the next session.